Hello viewers and welcome to another edition of our program. Today we will be talking about suicide and its prevention. Well, this is a topic we have taken up on the occasion of World Suicide Prevention Day. Well, this is a day, that is World Suicide Prevention Day, is observed every 10th of September worldwide to create awareness amongst people on the preventive aspects of suicide. Now, different activities, different events are organized by different agencies to create awareness amongst the people that indeed suicide is preventable and that it is a global health problem. According to World Health Organization, they have said and they have come up with the statistics that every 40 seconds someone commits suicide. And if we go by this figure, that means in a year worldwide there is a possibility of at least 80,000 people committing suicide. Now, some other people have put that figure to even 1 million. So that is why it is so important to talk about this problem, this issue called suicide. Now, it is also said between the age group of 15 to 29, suicide is one of the most common way of death. And it is also said that for every one death related to suicide, there can be another 40 attempted suicides. So that is why this issue is so important to talk, and especially now during this COVID situation when our lifestyle has changed so much that youngsters, adults, many people are struggling in fact to cope with this new lifestyle that we have all embraced. So today we will be talking about this issue called suicide, that it is preventable, and what role can individuals, family, community and other stakeholders, especially the doctors and the therapists, can play a role, and the society at large, to combat this problem called suicide. We have our experts here in the studio, but before I go ahead and introduce them to you, let us watch a short clip which is based on this topic that we have taken up for you today.
Suicide is one of the leading causes of death in the world. People aged 15 to 29 are the ones who are most likely to commit suicide. According to the report published by the National Crime Records Bureau, Sikkim and Tripura had the highest suicide rates in northeast India in 2019, closely followed by Assam and Meghalaya. The report also stated that in India, every hour one student commits suicide. Suicide is a very grave problem that afflicts our society. It may be caused and aggravated by many factors that occur in the society, such as unemployment, academic and career pressure, dowry disputes, love affair, substance abuse, illegitimate pregnancy, bankruptcy, mental illness and isolation. Suicide is a major problem around the world, yet it is underreported and under-researched. The fact that it is preventable, however, is a silver lining, and therefore more approaches to prevent suicide must be explored. Some approaches one can consider on a personal level includes reducing social isolation. Most individuals who are afflicted with suicidal thoughts find it hard to communicate their feelings to their friends and family, fearing that they might not understand the way they feel. This leads individuals to feel isolated and alone. However, research has shown that feeling connected and supported can help reduce suicide risk. Treating mental disorders. Due to the stigma attached to mental illness, many people refuse to seek treatment for mental health problems. However, in most cases, suicidal tendencies are likely to return if the underlying cause is not treated. Getting the correct treatment for depression, substance abuse, or other underlying mental problems can help people feel better and curb their suicidal thoughts. Promoting positive lifestyle. Mental health issues affect society as a whole and not just the individual. Although some are more vulnerable than others, no one is completely immune to poor mental health. Learning and practicing a few techniques to protect one's mental well-being could make a huge difference in a person's life. These might include getting enough rest, making time for self, family, and friends, cultivating and encouraging optimism, moderating intake of alcohol, exercising regularly, among others. Many people feel secure that suicide does not affect them and that their family members will not succumb to suicidal thoughts and impulses. However, the fact is that almost everyone has contemplated suicide at one point in his or her life and may know someone whose life was cut short owing to suicide. And since we know suicide is something that we can prevent, moving towards a suicide-free society may not be too far-fetched an idea.
Welcome back, dear viewers. Now that you have watched that clip, let me go ahead and introduce our panelists who have joined us today in Doordarshan studios to discuss on this topic. The topic is suicide and its prevention. To my left, I am being joined by Anisha Lingdo. She is the Assistant Professor, Department of Psychology. We also have with us Johanna Maury. She is also the Assistant Professor from the Department of Psychology, Martin Luther Christian University, Shillong. So, a very hearty welcome to both of you to our program and to Doordarshan Shillong to talk about this very important topic that we have taken up, isn't it? Yes. So, I come to you, Anisha, firstly. Tell us, why is it so important to talk about suicide?
So, as we've seen, there's been an increase in the cases of suicide, right? We have seen it that as time goes by, like you said, a lot of adults, a lot of youngsters have been committing suicide. And the question comes as, why? What's the reason, right? So when we talk about suicide, it's important firstly to understand the mental state of an individual. What is mental health? When we talk of mental health, it is a state of well-being. An individual realizes potential, can cope with stresses in the environment, is able to live to his full potential, and also contribute to the community. Now, what happens is that when that well-being, which we obviously would say a positive state, where we would experience a lot of positive emotions rather than negative emotions, where we experience a lot of autonomy, is being stripped off. We then have started feeling feelings of worthlessness, a feeling of loss. So if you look at suicide, it doesn't just happen immediately, it's always a culmination of a lot of life events. So it's very important to address that issue.
Okay. Yeah. So let me just come to you, Johanna. What is the significance of this day, that 10th of September, is being observed as World Suicide Prevention Day? Why is it so important?
This day is really important because, you know, it is a day where we are creating awareness about the importance of this issue. Like you were saying, ma'am, it is a public health problem, right? Millions of people are suffering. Millions of people think of suicide as the only way out. You know, their lives are valuable. And we hope that through this day we can create the awareness that is necessary. Because when we look at our own society, sensitive issues like these lay hidden, you know, we hide it under the carpet. We don't talk about it freely. So we hope that having a day for suicide prevention will educate people, will make them aware that the more we talk about it, the more we can help curb the issue.
Okay. Yeah, what you said is it's true that there is a lot of stigma attached to mental health. You know, whenever we hear of people having, say, suffering from depression or having some mental health problems, I mean, families and family members or the person himself or herself would hide it, right? Yeah. Would brush it off or hide it because there's so much of stigma attached to it. The society, the community have not been able to accept this fact. Yeah. And there are different terms given, you know, to such individuals.
Yes.
But then mental health is a problem, is a health problem like any other health problem that one can suffer, right? Tell us about the issue of mental health and how important it is to talk about and address this issue called mental health.
Okay, and again, even with mental health, you know, we do not talk about it freely. Most people do not realize how important it is. Just like how you take care of your body, you know, your physical health is important, your mental health is as equally as important, if not more. You know, you are not healthy if you're not mentally stable or mentally healthy, right? So with that being said, again, we need conversations. We need to talk. Anything that makes us sensitive, anything that makes us feel uncomfortable inside, we need to talk about those issues.
Right.
And here also in our own city, we see that we have these labels. We label people without understanding. We discriminate them, we judge them, and there's a lot of stigma, you know, and especially in families who have individuals suffering from mental illness. Instead of being compassionate, instead of trying to offer support, we judge them, right? And that is not how society can function. So we need to understand that.
Yeah,
That's
let's
very
talk about the
important.
stigma part again. Yes.
Yeah. So like what Ma'am Johanna mentioned, mental health is as important as physical health. I believe the mind is a very powerful tool. It influences the way we behave, the way we, that we think, the way we feel. So if you do not address it, people will not want to seek help for the fear. Fear is one thing that stops people from reaching out. And what happens is that when you're fearful, it becomes extremely overwhelming. The individual doesn't see a way out to express, an outlet to express. So for them, the only option is to kill oneself. That's important to address, because then we become more sensitive. Like I said, it's a culmination of a lot of events. It doesn't just happen immediately. A person might go through a lot of negative events time and again, try to reach out, but people refute it. Like, it's nothing. It's all in the mind. But they do not understand, by saying that, it leads to a much more
build up
slowly
Yeah, and
to the
then it
point where,
explodes.
like, what's the point of talking about it when I know that I'm going to get face judgment from the society.
Yeah.
So
And especially now, I think all of us, even our viewers have, understand this fact that this is a very unprecedented time that we are going through, right? None of us could have imagined that life would be this. And for some, maybe we have been able to take it into our stride slowly. But then there are a lot of other people who may not be strong, who may not be as healthy or as confident, and so they are taking it negatively, right? This lockdown period that you are more inside, whereas youngsters, college goers, school goers, they love to share time with their friends, to go out, to just hang around. The word is, right? They're not being able to do that anymore, right? Apart from this situation, there is salary cut of people. People are losing jobs. And, the whole dimension of this COVID is so broad that it has impacted almost everybody's lives, right? So how has how do you connect these two, suicide and COVID, or COVID and suicide? Have you all done any studies? Have you all been able to come up with any kind of research studies that is linking more of suicide cases now than before?
So when we look at research has shown, because there's a lot of research being conducted right now with the situation, because it's a very novel situation, and research has shown that people who are going through this, right? Recently in India as well, there was a reported case of 300 suicide deaths because of COVID-19, not because they were infected with coronavirus, but because of the situation, because of the lockdown. So that is really startling. People tend to end their lives because of anxiety. They fear of infection, again financial distress, like you were saying, and there's no way out. They cannot talk to anybody. And the first major report of suicide because of COVID-19 was reported from South India, where a middle-aged man, he was wrongly diagnosed. They diagnosed him with COVID when in fact he was having a viral infection. And then of course in the beginning he did isolate himself, quarantine himself, but then again with the news that he was getting, how people were dying of COVID.
And initially we did see a lot of stigma, right?
Yes,
people were mobbed, people, even our frontliners were attacked, targeted, right?
Yes.
Yeah.
So it is a really serious issue, and people are handling the best way that they can. And when it comes to India also, the number of mental health professionals is very less as compared to the problem out there. So we're hoping that this discussion, we can help ordinary people, you and me, how to handle problems on a day-to-day basis.
Absolutely.
So,
and that is why this day is observed, right?
Yes.
And that's why it's called World Suicide Prevention Day.
Yes.
Because suicide is preventable.
Yes.
So let's come to the preventable aspect of it, because I think we really need to stress more and more on it. So is suicide preventable, firstly? Yes.
So situations like what we're having now, the pandemic, makes us realize of a lot of things. It unravels a lot of the veracity of why mental health is so important. I talked about fear. Fear is a very, very important aspect. Because of fear, we tend to get very stressful, we get anxious, because these are unforeseen circumstances, and like you said, we're not used to this on a daily basis, right? So now the question is, people are not able to think rationally, they're not able to organize things, and they feel, you will see that they experience more of the negative emotions rather than the positive emotions. And then you will also see that the way they behave is also tends to be very impulsive. That's why we stigmatize people. That's because of fear. It's not because we have proper knowledge about it. So what's important is that how can we prevent it? First step is to actually have in-depth understanding first of the situation. In-depth understanding of why this individual is suffering from this. So I feel the first place is family. Family should always be a safe space where you feel a lot of connections. In the end, we're all human beings. We need social interaction time and again. So the first step, if you're able to talk freely about these things, an individual knows that there is a way to express. There's an outlet, which means I'm not the only one suffering from this. We all face the same situations. The only difference is the way we appraise it. For some, you can see a lot of resilience. For some, they're not able to do. That's the reason why we need social support.
Right.
So as a society, as an individual, we should act as protective factors. It's our duty to do that.
So first stress you're stressing is on the role of the family.
Yeah.
Quickly, your word on who are the other agencies that can play a role?
Again, first it's your family. If it goes beyond their understanding or beyond their way of helping, there's a lot of mental health professionals out there. Reach out to your local communities, your local hospitals. There are professionals who are trained to deal with these sort of issues. So you are not alone. There is help. And
what about the role of the friends? Because peer pressure is also there, right? I mean, so what role can friends also, because friends sometimes can, I think, have a both positive and a negative role also. So how does one choose one's friends, especially in these situations?
When we talk about that, I'll talk about the negative thing. One thing is, if you surround yourself with people who are very negative, who make you feel even worse than before, after having a conversation with them, I think that's the time you realize that you should just take a step back. Surround yourself with people who are supportive, who love you, because if they love you, right, they want the best for you. And you'll hear that if you just pay close enough attention to what they say, right, you'll know who wants your best interest and not. So just pay close attention to what they say, how they behave around you. And like I said, if they are true friends, they'll want the best for you. They'll encourage you to get help, and they'll support you. And there'll be no judgment whatsoever. So, you just have to be careful who you allow, who you surround yourself with.
Who you bring into your that inner circle. Because we have an inner circle of friends, we have an outer circle of friends, right? I mean, some core,
So I just want to add to that. When you choose friends, you are the one choosing it. As an individual, you play a very crucial role there. So if you know what you want, if you know whether it's enhancing me or it's detrimental for me, that's where, okay, I should hang out with these friends because I learned something from them. I know that if I go to them, I get something effective out of it. But if I go to certain people, if I talk to them something, I come back not feeling good. So conscious awareness about these things, because as humans, we're always on autopilot mode. We're never conscious of our thoughts. And then it's until we feel something, until we behave in a certain way, then we realize, why do I feel this way? So you have to be very sure about your identity.
So, but when we feel that way, it is also not too late. We can still
exactly.
take corrective steps, right?
Yes.
So, but then another aspect I think we should really talk about is, we'll come back to these the role of various agencies in preventing suicides. But then a person who, as you said, both of you said, that a person who wants to commit suicide, it is not an immediate thought that comes, right? It is over a period of time. That thought is there. It builds up and then it just explodes perhaps. So what are some of the signs and, symptoms we should be aware of, and family should be aware of, supposing, so what are the some of the signs and symptoms that a person may have suicidal thoughts?
So feelings of worthlessness, feelings of hopelessness, and then, feeling sad most of the day, and, when you do activities, you do not get any pleasure out of it, then realizing that, there's no hope There's
Okay,
no
so
feeling
you're
of
talking about the
optimism.
feeling of the person.
I'm talking about the cognitive aspect
Yeah.
first. These
So
are the
what-
warning signs
Yeah,
first.
yeah.
Then we'll move on to a little bit of the behavioral aspect. I
Mhm.
think that is quite important. I
Right,
think
right.
because, like you said, the cognitive aspect is just within the individual.
Exactly.
But the behavioral symptoms could be, especially at this situation right now, trying to avoid things that you do. Okay, sleeping too much. Okay, or having problems with sleep. And then it can
Eating
also be eating
problems.
habits.
Mhm.
All of that.
Yeah.
So you look at your physical activity, psychomotor activity. Before this, you might find yourself, you do get, you want to do something, you get motivated. Suddenly, you don't feel like doing it. You feel very sluggish. So these are some of the signs that individuals should be aware.
Can I just add
Yeah,
to that?
sure.
One of the main signs actually is if people have been contemplating that, I can't do this anymore, I have to end my life, what they do is they give away their belongings. Just like that, randomly, they'll give it to their loved ones, or they start giving off their things. So that's a major sign.
Okay.
And then another sign is they start talking about death. I feel like ending my life, I want to kill myself. And what happens is we always brush it off. Hey, don't speak like that, yeah, what's wrong with you? You have a beautiful life, right? We brush it off, but that is a warning sign.
Okay.
And another high risk factor is if they were a survivor of suicide, if they had attempted suicide before, they are at high risk.
Okay.
So we have to be more
So a
careful. and
person
sensitive.
can commit, can take that step
Yeah.
again. We'll
Yes.
try again.
Yes.
Yeah, repeated
Definitely,
offender,
yes.
you can say.
Yes.
Right? I mean, this is so significant what you said, because, yeah, and this is so valuable what you just said, because, family plays the most major role in an individual's life, especially for youngsters who are now more homebound. So these are some of the signs and symptoms that one should be aware of, especially the parents, that when a child is behaving a little abnormally than what he or she used to behave before that. Any other symptoms that we should be, because our parents, our mothers, our fathers are watching there. Yeah. So what are some of the other things that they should be
And,
careful of?
For parents, just notice how your child behaves. If they, especially drawing, if they're drawing dark stuff like death, skulls, if they're drawing death-related subjects, or if they write poetry about death, if they notice that, even that is a sign for help,
Okay.
because how you feel is a reflection of how you put out your thoughts. So drawing, writing is a reflection of that. So they need to be more sensitive to that. And then there's also an increase of use of tobacco, alcohol, drug use. That also
shutting
parents-
ourselves inside, spending
Yeah.
more time inside
Yes.
the room,
Yes.
not mingling
Yeah.
too
Yes.
much, right? Suddenly
Yes, isolating
withdrawing
yourself.
Withdrawing,
oneself.
yeah.
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 It can also be, like I said, as parents, they will see more of the behavioral symptoms, getting aggressive, impulsive, short-tempered. For parents, it's not to refute that. It's better to sit and, communicate what's the reason behind it. Because if you've seen your child the whole time, not, exhibiting any of that, it should be a sign that something is going on and we need to address it.
I think open and honest communication
Yeah.
is very important. Children should feel like they can go to their parents. Their parents should be the first people that they can
should-
go to.
yeah.
Right.
It should be a
without
safe
any
space.
judgments, because they are dealing life the way they think they know how, right? And as parents, we're supposed to guide them, right? So when your child comes to you, I know sometimes it's very difficult.
Difficult,
It's
yes.
not easy, but just keep your mouth shut for a moment, listen to them, and try to understand from their perspective. What are they really trying to say? What are they struggling with?
Yeah, because most times what parents does is that they take very quick punitive actions, right?
Yeah.
I mean, as parents, we think that we have to admonish the child, take other recourses that no, this is not permissible, not allowed. But are we listening?
Yes.
So listening to children is so
very
important,
important.
isn't it? And today's children especially.
Yeah.
Because I think in their own way they have a lot of stress that they are coping with, right? I mean, talk about the online studies that is happening these days.
Yeah.
It is not easy,
Yes.
right? I mean, teachers are pressurizing the children, and children are already burdened, and their mind is full of other negativities, and then this pressure, it doesn't work. So the role of the family, the role of the parents are equally important. But then when we are talking about, that suicide is preventable, it has been seen that in 80 to 90 cases, through counseling, by going through a therapist, suicide, one recovers from depression, from any kind of mental health. Let's talk about this, So how has a therapy, or how does therapy really work, and how does it help? Yes, Anisha.
Yeah, so like as mentioned earlier, it's always a culmination of a lot of life events. Let's say an individual goes through a certain event and the outcome has become extremely negative. Then maybe the individual started developing irrational beliefs. I'm not good enough, right? And then he goes to the same situation again, to the same outcome. So what happens is that it leads to something called rumination. So which means continuously thinking about negative thoughts. And that is very risky. Because now you just focus on negative thoughts, and what is even more risky is that you're actually believing in it. That, you know, I am hopeless, I am just helpless, there's no point. And you start seeing life in a very rigid way. You start having negative thoughts about yourself, your future, you know, about the people around you. That's the reason why it's important to go to therapy. Because then you get...
therapist is like any other doctor.
Yeah.
When we fall ill, like of any of a cold or a cough or any, we go to a doctor.
Yes.
Yeah.
And like I said, these negative thoughts can be extremely automatic. We go in autopilot mode. We do not realize that it's affecting our emotions and our behavior. So it's important to seek help, because then you get to address those thoughts, distorted thinking, you know, having too rigid, if your thought is too rigid. So it's important to address these issues, to become more flexible and to be open to therapy.
Right, yeah. Quickly, Johanna, you would like to add?
Yes, and like you were saying, I totally agree, and many people do not understand that. If you get a cold, stomachache, you go to a doctor. If you have a problem with your mental health, go to a therapist, go to a counselor. They are trained, right? And the thing is, with counseling or with any therapy, they help you use your strengths, your own personal strengths in handling your difficult situation. So they help you use your own strengths.
Right. They make you realize your own self-worth,
Yes.
which you have lost.
Yes.
They make you regain that
Yes,
back
and
again.
all of us have strengths. You know, if the viewers who are watching, they feel like they don't have, and all of us have our own strengths. We just need to inculcate it. We need to just, you know, help. Sometimes we need help from others to
help us.
to help.
Right?
See the strength.
Because see, there is a moment, there are phases in each of our lives when we break down, when we go through depression, when we feel that life is worthless. But that doesn't mean that we will be contemplating to ending it, right? Life is a beautiful gift given to us, to each one of us, and we should live it to our fullest potential. As we are almost winding up this program, what are your last concluding words, Anisha, to all the youngsters, to all the parents who are watching this program?
So as humans, I believe we have the resources we have within us is limitless. It's just the ability to identify that life is worth it, that, like you said, life is a gift, and not giving up. So self-evaluation, the kind of self-talk you have with yourself, you should always make sure it's always positive. Even in the face of adversities, you can always come out stronger. Instead of saying that, I lost it, or I'm not worthy, it's more saying that I learned from the situation, I overcome it, so that I become a better human being and be able to deal it more effectively in the future.
Absolutely. And I think, Johanna, I don't know if you agree with me, spirituality does help, doesn't it? I mean, if you have a conversation with your own God within, it does help to overcome so many situations. So is it also necessary sometimes for a person who's going through certain situations, problems, to be a little bit more spiritually inclined too? And does it also help, wave off those negativities from within?
To say that, I cannot speak for others who, if they do not believe, it's their perception. But, even if they do not believe on, let's say, God, if they do not believe in that, at least believe in the social connections that you have, believe in the love that you're receiving from your family or the loved ones that you have around you, and talk to them. And before we end, I would just like to request everybody, if you see a family member suffering, ask them. It's very controversial. How do we ask, right? When we're talking about mental illness, ask them, are you feeling low? Have you had thoughts about ending your life? And if they say yes, then you can take steps to help them. And
that's what I said right in the beginning, that as community, as society, we also have a very, very proactive role to play. Not just the family within. We belong to a big family called the human family, the society. That's why so many families make up a society, and that's what each of us need to take care. We have to open the channels. If somebody is seeking help, we must, try to give help. And if it is beyond us, always take that person to a therapist also.
Yes.
On that note, we could have discussed, but then wonderful thoughts that have come from the two of you. Thank you so much,
Thank you,
Anisha, and
ma'am.
thank you so much, Johanna, for
Thank you,
coming to
ma'am.
the studios of Doordarshan and indeed talking about this very serious issue that we have taken up on the occasion of World Suicide Prevention Day. And those of you who are watching this program, in case you're feeling a little worthless sometimes, I'll tell you, as somebody who's a mother, who's a parent, I'll just tell you, just put your hand on your heart. You'll feel something is beating inside you. Well, that is your purpose. That is the purpose for which you should live. However bad the situation may be, ending your life is not the answer at all. Please put it in your head that life is a beautiful gift given to each of us, and every morning when we wake up, it's a new day. And take each day as it comes and try once again, because when you commit suicide, remember you leave behind many, many other people who are saddened by this, because there are a lot of people who love you. Thank you very much for watching this program, and do look after yourself. Until next time, from all of us here, it's bye-bye.